Hello everyone, I'm Tzuemn Yee. In this presentation, I'm going to present the introduction, the history of telemedicine, modern telemedicine, and also telemedicine in the pandemic of COVID-19. So we start from the introduction first. So what is telemedicine? WHO defines telemedicine as the delivery of healthcare services at a distance using electronic means for the treatment, diagnosis, and prevention of injuries and disease, research and evaluation, and education of healthcare providers. During the pandemic, telemedicine has been widely used to perform patient counseling. While telemedicine has experienced epic growth in response to the pandemic, it is expected to continue to be a vital medium for healthcare. Now let's move on to the history of telemedicine. The first recorded instance of telemedicine was in the first half of the 20th century when electrocardiograph (ECG) was transmitted over telephone lines. In the 1960s, major teaching hospitals started to provide professional medical advice to an airport medical center, and television was used to perform discussion between specialists. Telemedicine also played an important role in disaster management. NASA was the first to use telemedicine services during the 1985 Mexico City and 1988 Soviet Armenia earthquake. Inventions such as telephone play an important role in launching the modern telemedicine as we know. For example, dialing emergency contacts such as 999 or 911 gave faster access to the emergency medical assistance. Now, let's see the modern telemedicine as we know. Rapidly developing scientific and technological advances in sensors, robotics, artificial intelligence, data analytics, and virtual reality provide a strong foundation for delivering precision medicine. Patient education through images and videos, transfer of medical images such as scans and x-rays, real-time voice and video consultations have all become reality. Improvements in internet infrastructures made telemedicine cost-effective and stress-free. Now, let's see some application of telemedicine during the COVID-19 pandemic. In UK, King's College London, together with Guy's and St Thomas Hospital, have developed an app that allows citizens to self-report their health condition. Citizens were asked to provide information such as location, age, gender, and any existing medical conditions. They may also report that they are healthy or not. If not, they can answer questions that covers a wide range of symptoms. Data from the app can be used to identify how quickly the virus spreads, where the high-risk hotspot areas are, and who is the most at risk. That's all from me. Thank you.
Good morning, everyone. My name is Eng Choo and metric number 276957. So I will continue with the part of advantages that telemedicine bring to us. Undeniable, telemedicine had brought a lot of benefits or advantages to us, such as it can reduce the spread of coronavirus COVID-19, making us more comfortable and convenient, saving time, costs, and access to specialists. So let's start with the first point. Telemedicine can reduce the spread of coronavirus. To reduce the spread of coronavirus, the main thing is to avoid physical contact among people. However, it is very difficult to achieve in the traditional way people seek medical advice, as they will have face-to-face conversation with doctors, nurses, and sometimes other patients. Besides, travel to the hospital also has the risk as some of them use public transportation. So, by using telemedicine, all these things can be overcome. It can reduce the spread of coronavirus as people do not have to go to the hospital to seek medical advice for every illness. Some diseases like influenza, migraine, mental illness, and so on can be treated through telemedicine. They just need to stay home, make an online appointment with the doctor, and then the doctor will give medical advice via video chat or phone. This has reduced physical contact with others and reduced the spread of COVID-19. Next, telemedicine making us more comfortable and convenient. It enables patients to receive that medical treatment and advice in the privacy and comfort of their own homes, so they do not have to rush to the hospital or clinic and wait in the waiting room. Sometimes it is very difficult and uncomfortable for the patient to stand in the waiting room, to wait for the doctor as the seats in the waiting room are full. Furthermore, telemedicine is a better option for mental illness patients. They will feel more comfortable, relaxed, and calmer while receiving therapy at home compared to a hospital which has more strangers. So, psychotherapy through telemedicine is more comfortable and convenient for patients. The third point, using telemedicine can save patients time. When we go to a hospital, we often spend a lot of time waiting in long queues or going through complicated procedures. And for who are living in rural areas, may also take a long time to travel to the hospital. But by using telemedicine, patients can get the doctor with just their fingertips. They just need to sit at home and make an appointment. The doctor will then hold a video conference call or email to the patient using a digital device. Procedures in telemedicine are also simpler and easier compared to procedures in hospitals. So this really saves their time. Next, save costs. Since patients do not have to go to the hospital, they have saved on transportation costs. For example, instead of going abroad to visit a specialist, patients can use telemedicine to hold video conferencing with the specialist at home. This helps them save on airplane costs which are quite expensive. Besides, telemedicine payments are easily billable to the patient health insurance in most cases, so using telemedicine can save the patient costs. The last point, access to specialists. Telemedicine can help patients gain access to specialists more easier. This is because they do not need to spend a lot of time from visit the specialist, as most specialists are not close to where the patient is located. By using telemedicine, patients can receive medical advice and treatment from specialists who are far away from them without leaving home. So that's all from me. Thank you.
Assalamualaikum and hello everyone. My name is Nik Nurin Afza binti Nik Ibrahim and my metric number is 279936. What is disadvantages of telemedicine? Telemedicine, on the other hand, may not be appropriately for everyone or every circumstance. So, if telemedicine is used instead of traditional care, there are certain possible drawbacks. The sections that follow look at some of the drawbacks for patients and healthcare practitioners. Disadvantages of telemedicine for patients. First, insurance coverage. The telemedicine is not covered by all insurers. In some regions, health insurance plans are required to compensate telemedicine appointments at almost the same rate like in checkups with doctor. Telemedicine service may be compensated by Medicaid if they satisfy all federal regulations and eligibility criteria. Second, the lack of availability and expenses. Telemedicine service may not even be available to some patients. Telemedicine consultation, like any other medical appointment, costs money. It may incur little or no expenses if you are using a telemedicine service. It might also be charged as a regular medical session with both the usual high deductibles. And the last one, for patient protecting medical data. It is critical to safeguard medical information. Hackers and other criminals may have access to a patient's medical information, particularly if the patient uses telemedicine on a public network or over an unencrypted channel. Hackers have been ducking it out with the healthcare providers in charge of the telehealth encounters. Next, disadvantages for providers of healthcare. First, licensing problems. There is always issues that occurring with state regulations differ. Clinicians may not be authorized to practice medicine across state boundaries based on the state in which they hold their license and the state where the patient resides. These studies demonstrate that ethical issues in telemedicine can be examined from a variety of perspectives, including technology, the doctor-patient interaction, data confidentiality of information. Second, concerns about technology are prevalent. It can be difficult to choose the correct digital platform to employ. A poor connection also can make it difficult to provide high-quality care. Clinicians must also guarantee that the telemedicine software they employ is trustworthy and complies with all applicable privacy regulations. And lastly, an inability to examine patients. Providers are unable to examine patients during telemedicine sessions since they must rely on patient self-reports. This may necessitate professionals asking extra questions in order to obtain a complete health history. If a patient fails to mention an important symptom that was visible during in-person therapy, treatment may be jeopardized.
Hi everyone, my name is Zaki and Hock and number metric is 277027. For today, I would like to explain the impact of telemedicine. The impact of telemedicine can be divided into three. That is the balance of great medical resources across regions, IT sector integration in healthcare, and improved medical service skill. First and foremost, telemedicine can affect the balance the gaps in medical resources across regions. By using telemedicine, it can help to solve the problem in inequality of medical resources in urban and rural areas. For example, doctors in urban areas can transmit various medical image and file in rural area, thereby improving the medical skill of local doctor. This can helping local hospital achieve the same medical level as urban area. The second impact of telemedicine is IT sector integration in healthcare. It means transition for traditional healthcare to e-healthcare by using telemedicine. For example, since outbreak of the COVID-19, many medical systems had implemented functions such as online registration and payment of the medicines expand to reduce the risk of coronavirus infections. My third impact of telemedicine is improved medical service skill. Telemedicine can be implemented to provide program to the instituted course to teach the telemedicine communication and evaluation skill. It can be applied to the treatment of the future patients, such as coaching patients to use the virtual health platforms. That's all for the impact of telemedicine, and now I want to pass my section to other group members. Thank you.
Hi, my name is Muhammad Zaki bin Kafidhin, number metric 276949. Next, I will be presenting about the challenges faced by telemedicine during COVID-19 pandemic in Malaysia. The first challenge is about the lack of money and time. The introduction of telemedicine requires major investments in equipment and education. In healthcare, it is often difficult to carry out advanced economic planning since conditions may change over time. Many of these trials are also driven by enthusiasts who are willing to dedicate much of their free time. However, when it comes to implementation, the incentives also often change and costs must be covered within the framework of the normal budget. Next, the second challenge is about the malpractice. The elements of negligence in the traditional mode of healthcare delivery, namely duty of care owed by the doctor to the patient, breach of the duty of care, and causation or consequential damage to the patient, are equally relevant in telemedicine malpractice. Unlike the traditional setting where the doctor and patient are in the same consultation room, the inherent feature of telemedicine is that both parties are separated by distance. This will usually not create added difficulties in establishing a doctor-patient relationship except in the case of cross-border telemedicine. Under the Telemedicine Act 1997, cross-border telemedicine can only be carried out through a local registered doctor. On the assumption that this remains the position when a legislative telemedicine framework is eventually enforced, it is foreseeable that difficulties could arise in determining who the parties are in the doctor-patient relationship. The third challenge is about the insurance. Combining rapidly changing communications technology with the complexities of healthcare delivery carries with it the possibility of new or increased risk of medical malpractice. Doctors need to ensure that their professional indemnity insurance extend to cover healthcare services rendered through telemedicine. Currently, there is no set standard for private health insurance providers regarding telemedicine, and thus it behooves doctors to discuss this with their insurance providers. Alternatively, the medical industry could pursue this with the relevant medical indemnity providers. Informed consent. The doctrine of informed consent requires doctors to provide their patients with sufficient information so that the patients can assent to or withhold consent from a medical treatment. A patient needs to be informed of telemedicine's risks, benefits, and limitations. Thus, a doctor should discuss with his patient the risks or limitations affecting medical examination and consequently medical advice. It is also important to notify the patient of technical risks associated with electronic transmission that could cause distortion in images, unauthorized interception of electronic communications, or illegal access to the patient's electronic medical records. When the doctor intends to audio or video record the consultation, he should inform the patient and seek his consent. The last challenge is the fear of computers. Experienced computer users view telemedicine as a natural tool, but those with a poor command of computers often view the technology as a problem. Furthermore, many write slowly and find computers to be time-consuming. The fear of computers is often viewed as a challenge toward the acceptance of telemedicine. It may appear to be a simple gap to bridge. However, some individuals find it difficult to admit their need for training. In an educational situation, many people could be confronted with the fact that they lack even basic computer skills. This is a situation they may have strong reasons for avoiding. Hence, it will take time for them to learn and accept the new way of providing healthcare and solutions during this pandemic outbreak.
In conclusion, as we have seen, telemedicine has a huge impact in our daily lives, especially during the COVID-19 pandemic in Malaysia. It has brought both advantage and disadvantage to us. So we know telemedicine is Malaysia still immature and has many challenges to face. This is our finding in telemedicine. That's all for us. Thank you.